going to tell you about asthma. Asthma is a common long-term inflammatory disease of the airways of the lungs. Many environmental factors have been associated with asthma's development and exacerbation through allergens, air pollution, and other environmental chemicals. Smoking during pregnancy and after delivery is associated with greater risk of asthma-like symptoms. Low air quality from factors such as traffic pollution or high ozone levels have been associated with both asthma development and increased asthma severity. Over half of cases in children in the United States occur in areas with air quality below EPA standards. Asthma is associated with exposure to indoor allergens. Common indoor allergens include dust mites, cockroaches, animal dander, fragments of fur or feathers, and mold. Efforts to decrease dust mites have been found to be ineffective on symptoms in sensitized subjects. Certain viral respiratory infections such as respiratory syncytial virus and rhinovirus may increase the risk of developing asthma when acquired as young children. Certain other infections, however, may decrease the risk. The Hygiene Hypothesis attempts to explain the increased rates of asthma worldwide as a direct and unintended result of reduced exposure during childhood to non-pathogenic bacteria and viruses. It has been proposed that the reduced exposure to bacteria and viruses is due in part to increased cleanliness and decreased family size in modern societies. Exposure to bacterial endotoxin in early childhood may prevent the development of asthma, but exposure at an older age may provoke bronchoconstriction. Family history is a risk factor for asthma, with many different genes being implicated. If one identical twin is affected, the probability of the other having the disease is approximately 25%. By the end of 2005, 25 genes have been associated with asthma in 6 or more separate populations. Asthma is the result of chronic inflammation of the conducting zone of the airways, most especially the bronchi and bronchioles, which subsequently results in increased contractibility of the surrounding smooth muscles. This, among other factors, leads to bout of narrowing the airway and the classic symptoms of wheezing. The narrowing is typically reversible with or without treatment. Occasionally, the airways themselves change. Typical changes in the airways include an increase in eosinophils and thickening of the lamina reticularis. While asthma is a well-recognized condition, there is not one universal agreed-upon definition. It is defined by the Global Initiative for Asthma as a chronic inflammatory disorder of the airways in which many cells and cellular elements play a role. The chronic inflammation is associated with airway hyperresponsiveness that leads to recurrent episodes of wheezing, breathlessness, chest tightness, and coughing, particularly at night or in the early morning. These episodes are usually associated with widespread but variable airflow obstruction within the lung that is often reversible either spontaneously or with treatment. There is currently no precise test for the diagnosis, which is typically based on the pattern of symptoms and response to therapy over time. The diagnosis of asthma should be suspected if there is a history of recurrent wheezing, coughing, or difficulty breathing, and these symptoms occur or worsen due to exercise, viral infections, allergens, or air pollution. Spirometry is then used to confirm the diagnosis. In children under the age of 6, the diagnosis is more difficult as they are too young for spirometry. While there is no cure for asthma, symptoms can typically be improved. A specific, customized plan for proactively monitoring and managing symptoms should be created. This plan should include the reduction of exposure to allergens, testing to assess the severity of symptoms, and the uses of medications. The treatment plan should be written down and advise adjustments to treatment according to changes in symptoms. Medications used to treat asthma are divided into 2 general classes: quick relief medications used to treat acute symptoms, and long-term control medications used to prevent further exacerbation. Antibiotics are generally not needed for sudden worsening of symptoms. An inhaler, puffer, or pump is a medical device used for delivering medication into the body via the lungs. It is a treatment of asthma. The most common type of inhaler is the pressurized metered dose inhaler, MDI, which is made up of 3 standard components: a medical canister, plastic actuator, and a metering valve. H&T Press Part, based in Blackburn, United Kingdom, provide over 75% of the world's can and actuator components to the pharmaceutical market. The metering valve is supplied by a number of companies, including Aptar and Coster. In MDIs, medication is typically stored in solution in a pressurized canister that contains a propellant, although it may be also a suspension. The MDI canister is attached to a plastic hand-operated actuator. On activation, the metered dose inhaler releases a fixed dose of medication in aerosol form. The current procedure for using an MDI is to first fully exhale, place the mouthpiece of the device into the mouth, and having just started to inhale at a moderate rate, depress the canister to release the medicine. The aerosolized medication is drawn into the lungs by continuing to inhale deeply before holding the breath for 10 seconds to allow the aerosol to settle onto the walls of the bronchitis and other airways of the lung. Some inhalers are made to act instantly in case of an asthma attack, and others are made to act later. Many people with asthma, like those with other chronic disorders, use alternative treatments. Surveys show that roughly 50% use some form of unconventional therapy. There is little data to support the effectiveness of most of these therapies. Evidence is insufficient to support the usage of vitamin C. There is tentative support for its use in exercise-induced bronchospasm. In people with mild to moderate asthma, treatment with vitamin D supplementation is likely to reduce the risk of asthma exacerbations. Asthma was recognized in ancient Egypt and was treated by drinking an incense mixture known as kai-fi. It was officially named as a respiratory problem by Hippocrates circa 450 BC, with the Greek word for panting forming the basis of our modern name. In 200 BC, it was believed to be at least partly related to the emotions. In the 12th century, the Jewish physician-philosopher Maimonides wrote a treatise on asthma in Arabic, based partly on Arabic sources, in which he discussed the symptoms, proposed various dietary and other means of treatment, and emphasized the importance of climate and clean air. In 1873, one of the first papers in modern medicine on the subject tried to explain the pathophysiology of the disease, while one in 1872 concluded that asthma can be cured by rubbing the chest with chloroform liniment. Thanks for watching this Adventurous Kids episode.